The answer is right here with Doreen and Grace.
But do we really have the right answer?
Maybe, maybe not.
But we try to make sense of what's happening around us.
Hello everyone, welcome back to another episode.
So a lot has been happening in the past week.
Yes.
That we are going to talk about in this podcast.
Mm-hmm.
Starting from people being sick and recovering to SHA issues. Like it's just two different realities.
Yeah, we'll bring you into these two different realities. My experience and Doreen's experience. And you know what? Grab some coffee, some wine, tea, or whatever you like, and listen and enjoy, and maybe share your experiences, the comments, like, subscribe, do what you need to do to support us. It's free.
Yes. So last week we were in separate parts of the country.
Yes.
But at least we are back together.
Yeah, I missed you.
And I'm not gonna lie, it felt like really different and very long.
Yeah.
I'm like, Kwani, when did we last record this podcast? I feel like it's been even a month.
Yeah, it's only been a week with a few days.
Mm-hmm.
We are missing each other.
Yeah.
Just say you missed me.
Fine, I missed you. I missed you. But at this point, I just want to understand, how did you get sick and what was your experience? Because, girl, we need to know.
Yeah?
Yes.
I got sick from... Now, I don't know how to explain the time on this podcast, but it was on a Friday. It was the Friday before last Friday.
Mm-hmm.
Yes, and I went to hospital. You know how we be. Tunavumilia hadi tunaona hatuwezi vumilia. And I went to hospital on Monday. Yes. That's when things went south completely.
So how was it?
How was what, Doreen?
How was everything? Like you've just been telling me, and we were catching up, and you're like, at least SHA worked for me. I can say like SHA is working.
Yeah.
And just different experiences. How do you feel like just having gratitude over like just being healthy?
You know, when you're sick, that's when you realize health is everything else. Yeah. Literally nothing else matters if you're sick. So for me, yes, SHA did come through for me. I did not expect it. I should say I've never used it before, but I've been paying for it. So I've never been in a hospital, or rather in a ward before. It was my first experience. And I remember before I was admitted, this doctor came and asked me, "Uko na SHA?" I was like, "Yeah, I do." And he was like, "Okay, so this will cover for you." Sikuwa naamini. What do you mean it will cover for me? Everything. And he said yes. So I was admitted for 3 days, Doreen.
Sorry.
Imagine 3 days in a hospital.
It's a lot.
Oh my God, the people that I found in that ward, they were from young people to old people. The young, I don't know, diseases nowadays, they're affecting everyone.
Yes.
I found 2 ladies about my age or even younger than me who are going through diabetes.
Quite unfortunate.
That was crazy. So even them, we had a chat with them because we were actually released from hospital the same day, which was Friday. And SHA covered all our costs. So it was not just me, even the few ladies that I found there, SHA covered everything. I'm telling you, everything from lab fees, admission, the ward fees, the nurse, all those, the triage, everything, it covered everything. I paid 0 bob, and so did the other girlies, until maybe when you have medicine that is not in the hospital, that's when you go and find it.
You're referred outside.
You're referred outside.
Yeah.
And mostly it. So, well, I'm grateful to be healthy. Alive. And it was one experience that I'm still reflecting on it. I don't know what God really wanted me to learn about it, but trust me, I'm just grateful to be healthy. Something else that I saw was now the ladies who are, or rather, let me say the old women that I found there. I'd suggest, Doreen, I'd suggest we be self-reliant even in our old age. Even on your deathbed, please be self-reliant. Be able to afford a nurse who can come and take care of you. Because your kids, oh, my friend, you can't count on them. You really cannot. Because those ladies have kids. It's not like they don't have kids. They do. Hata tulikuwa tunashangaa what's happening, what's not happening. Imagine all those days I was in the ward, nobody came to visit these ladies. It's the nurses who are taking care of them. Nojue hawatoki kwa kitanda. Being self-reliant is
very important.
Is very important.
So at least that was a rare moment for you of trust in the public system. At least,
that's one case that I don't know, it has worked.
It has worked. So as much as we are saying it doesn't work, some of us, at least we know in some places SHA works. Also for my sister, she uses SHA and it works for her. So I can say at least that's one thing that has worked. But then on the other side, we have a very different case of what's happening around us.
Yeah, you were in Nyanza,
yes,
Kenya.
Yes, I visited Nyanza. I started in Nairobi and toured like half Nyanza from Siaya, Kisumu, and Homa Bay, and came back to Nairobi yesterday.
So tell us what you saw, what you weren't prepared for. Give us a small rundown of how Nyanza was.
Wow, where do I start from? But it was heavy, just learning each and every day. People go through a lot. So in reality, as you talk about SHA working, kwa ground, it was quite difficult and quite hard to take in all of that from, because I started in the other side of the lake in somewhere in Siaya, and I could see a lot of issues of poverty, issues of early pregnancy, teenage pregnancy, issues of just survival.
It's bad, yeah?
It was bad. Just from Siaya, I came to Kisumu, floods, just how it affected people during flooding. Came back to the same reality of the economic situation and just kids dropping out of school for survival or just for economic activity that for quick cash, let me use that. That was my experience all through. In one word, I could just say survival.
Survival
is real, yeah.
So talking about the fishing communities, what does like a normal day look like for the women you met?
It's different in the two situations, but I can say women in a normal day, I could see women waking up at 6 a.m. to go get fish, because normally they fish at night. Yes, so you wake up in the morning, go get fish, dry it from there, maybe until midday. That's when they start coming back home. The same situation in the other side of the lake. So I can say just in the beaches, that is a normal day for women. Waking up, going to just do, because the main economic activity is fishing. Go get fish, come dry them. Mostly they use sun drying, dry, then come back home. But then what caught my attention was the high rate of HIV/AIDS in the region. And I could call it, I don't know, they call it Jaboya system. Sex for fish.
Sex for fish.
Yeah, like you get to a point that you have a lot of dates that you cannot get fish. So the only option is sex in exchange for fish. That is what so many women are doing there. And it's quite unfortunate due to just poverty. And I don't know, it was I couldn't say it was a good experience, but I was there to learn each and every day.
Would you say it's a lack of choice? Or it's just how they survive? It's because maybe a woman in an urban area has so many things that she could do, like aende Gikomba, aende auze mahindi choma, afue nguo. So is it a lack of choice?
To some extent, I can say that, but there is a moment like you are born in such a circumstance, because even this affects young children.
Yeah.
So when you're automatically born in such a circumstance, you're already exposed to different economic activities. And this I'm also talking about even men at a very young age. You can go to fish and come back with money. So at a very young age, money, you can go get fish, sell, you see.
You only know fish.
Yes, they only know fish and as an economic activity in the region. So it's quite not a choice, but I think they're just used to that. Because I could even see immigration is very high because it's in the lakeside, and you could see maybe, what is it called, boats, or they call it water buses, moving from the other side coming to. So you could see many Rwandese, Ugandans coming in just to look for opportunities at the lakeside. And in that case, you could see sometimes when maybe you don't sell fish, you have dead stock, you need fish for tomorrow. You see, then these HIV cases are very high in those areas.
Yeah.
So you'd find like one man sleeping with so many people. At some point, I was even talking to Mzee wa Kijiji, and he was trying to explain to me like what normally happens. And in fact, it was he told me an experience of, you see, of issues of STIs, sexually transmitted diseases. That he was saying like the STI in Uganda is very different from STI in Kenya.
Allah.
And you can even realize very long lady. For you to realize that you have STI, it will take very long. And it is a very bad infection. When you get it, it's bad. Not even in Kenya. Like you can realize you have an infection maybe in 3 days. That is what he was telling me. And also issues of HIV, you'd find this person sleeping with this woman today, the next moment they are with this. Then, or even when a woman has STI and sleeps with a man, when a man comes and tells them, it becomes an issue, because the woman will say, "You're the one who has infected me."
Yeah.
They don't even know they're the ones who have done that. So most of the time they keep quiet, and that is how HIV is transmitting in the whole region.
And they
Quite
have
unfortunate.
very high cases. I was there in 2018, Homa Bay.
Yes.
And the same cases you're telling me are the same that are happening till right now. And because I remember back then in Homa Bay, it was with an NGO over there, and tukienda kuwasaidia huko kwa give them fishing nets and all that. You find the politics there, it's ukiongeza boat unaongeza bibi, ukiongeza boat unaongeza bibi. Yeah. And a lot of we also dealt with a lot of teenage pregnancies.
Yeah.
And I'm wondering, because since then it's almost, let's say, a significant amount of years, there's the devolution, there's all these.
Yeah.
Is the system failing them, or what would you say?
I think it's the circumstance that they are in, the economic survival. So you don't have a choice. You want to survive each and every day. And you'd find even when you are talking about teenage pregnancy, some parents are the ones who even support that, because they see an economic opportunity in the guy who impregnated the lady. So they are like, at least this guy normally brings something. So they don't even follow up on the case on teenage pregnancy. You'd find even the parents hiding the child because they are getting support from the person who impregnated the child. Yeah. So in some even circumstances, they get to move the girl from that place.
Yeah.
So no face, no case. It's that way.
Gosh.
Yeah. So people are trying to survive. It's like it's just an economic structure problem in the area.
But until, because how many years are we into devolution?
Yes.
There are some I feel like we are at a point where there are some cases zinafaa kuwa at least reduce.
Yes. And I was also, when I said I talked to the mzee wa mtaa, he was predicting, mzee wa kijiji, the person who is in charge of the area, he was predicting like 150 deaths in the next like 2 years. Caused by issues of HIV. Yes. So you could see when initially they had these donors coming in, issuing preps, you know, preps,
Yeah.
preps, condoms, all those preventive measures, including even educating them on how to keep safe. But then when donor support was cut, so it's still spreading, but then no one is coming in with support. Yes. That's why you were saying in the next 2 years, it will be a very big problem.
Now watu wako na SHA?
I'm not sure about that because I didn't ask about it. But I think they have, some of them have. But do SHA cater for these drugs, HIV drugs? I don't know.
I think it should.
It should.
Yeah.
I'm not sure about that. Yes, I'm not sure, but I think they have SHA because definitely they have health clinics around and they visit those health clinics. So some of them
do visit, or it's just a number of them who know that they should visit and they can access healthcare.
Yes, they do access because they have healthcare, the health clinics around. Yes.
Okay. It's when you imagine, it's the same Kenya we are living in. Their experience and my experience here is
quite different.
Day and night, literally.
Yes,
day and night. Because within that week, I had access to like 3-4 doctors, and I was not even that sick. I had access to a surgeon, to a doctor, to a radiographer. Just easy. It was and I don't know them. It's not connection or anything. They were just there.
But it's quite unfortunate when we talk about the health system and also issues of gender inequality, but other women are still facing the same challenge in terms of economics, in terms of just getting medicine, being educated, just being told other channels of making money or other ways of survival. They don't even have that. Even teenage, you just find a very young woman, a very young woman breastfeeding.
Yeah.
You are like, how old are you? The girl is so young. So you are like, what is happening here? As much as we are talking about gender equality, what is happening here? So it's quite unfortunate, and I think we also need to focus on those regions because it's also the work of the NGOs and civil society organizations to look at that, but also the government should know in each and every place what is happening in terms of even survival, economic activities, issues of empowerment, issues of employment.
And empowerment should not just be words.
Yes.
It should be money. Give
Actions.
us money. How are we saving this money? How are we doing all this?
Yes.
Yeah, it's a bit sad. So you also told me you were in Nairobi slums, yeah?
Yes, I started with Nairobi slums.
Yeah? You started there. So
yes.
What was most prevalent there?
Prevalent in terms of?
What was most prevalent, like drug abuse?
There was drug abuse, but then before I got to that, there was what was really good, because I've also stayed in Nairobi. They have that unity. There's a community. They even call it community. There's that oneness, such that when even something happens in the community, it is dealt with well. Even the elders or the chairman of the community really understands the issues that the community have.
This is Nairobi now.
Yes, this is Nairobi.
And
like they have oneness, not even unlike Nyanza and like other parts of Nairobi. where I've
Okay.
lived. There's that oneness, there's that community
The nyumba
in those
kumi works
places.
well there.
Yes, it works well. Issues of empowerment. I didn't know even Kazimtani is there.
It's still there.
It's still there. It works well in these places. Issues of even empowerment, empowering their young men and women on even organizing games for them to even go play football. It worked really well. But apart from that, the issues of drugs and substance abuse was still strong in these regions. Yeah, you could see even other visiting neighborhoods. Kids come to these areas. So you could find that they were even saying that their kids are not like, most of them don't use drugs, but you could find that those neighbors, like the leafy suburbs, children could come to the area, and those are the people who camp in the regions, and they use drugs. Yes. So that was the case that they were really dealing with in urban settlements. But apart from that, I just loved their way of
Oneness. Yeah.
yes, way of oneness. I loved that. Yes.
But clearly, according to this conversation today, social inequality is really high in Kenya. The gap
Yes,
between
yes.
people who have and people who have not.
Yeah, the haves and have-nots. There's that big.
Very big.
Yes. And it's something that inequality has been there and we've tried. But just imagine a society where everyone is, if you need water, everyone has water.
Yeah, the basics too.
Yeah.
Water, health, education.
Not even the basics, like a very special world where everything is just working, no one is making mistakes, there's no inequality. Like, how will it be? Yeah,
Very dreamy.
Yeah, it's dreamy, but we are looking at, we accept challenges. So like something cannot just be pure and everything is just good.
But still, hata kama ni hizi challenges, there are some challenges that shouldn't be happening, like teenage pregnancies, you know.
Yes. Quite.
Floods, yeah, maybe because sometimes you can't, kunyesha tu kutanyesha sana.
Yeah.
Can be out of our control, though we can have measures to take care of that. But vitu kama teenage pregnancies.
And talking of floods.
Actually, let me give you a story. When I was in the ward, and this is a bit sad because we need to finish and go to the hot takes and stuff. When I was in the ward, there was this lady. Okay, she was not a teenager, but she was 20 years old.
This is when you're in hospital?
Yes.
Okay.
Yes. She was 20 years old. This lady was pregnant, 3 months. She had pressure, and she was sick. It was so bad. Unfortunately, she died. Yes. And she was living with a boyfriend. She had no ID, and the parents from her side, or rather her people, do not know.
Quite unfortunate.
Can you imagine?
It's sad.
20 years, she was already pregnant. Boyfriend amemweka hadi akakuwa mgonjwa kabisa.
Ndio akamleta
hospitali na akakufa.
And now you are looking at, this is a 20-year-old, someone who is responsible for themselves, because we believe when someone is 18, they are responsible. And now in cases of other parts of the country, a person is 14-year-old and they are pregnant. And the parents are even supporting that because they are getting
chums kidogo from the guy.
It's already a problem that we need to look into. And before we run out of time, you mentioned something and it also clicked my mind, issues of floods that I also experienced in these regions. Yeah, you could, I went where these people, like those places are their ancestral homes.
Yeah.
They cannot move. They have very big pieces of land, but you walk into someone's door, flooded. You could even see traces of water on the walls and the level of where the level of water was getting. Yes. You could see that. So is this a system failure or what? We need to ask ourselves that. But before we get out of hand, or before we talk too much, we need to move.
Because these are issues that are sometimes unashanga sasa. What can I possibly do on my end?
That's why we need more policy makers.
Yeah.
Yes.
Anyway, so as we conclude that, let's do some hot takes. Yeah?
Yes.
Some hot takes, some reality check. Number 1, Doreen. Development aid in Kenya is more performative than impactful. Agree or disagree?
I agree.
You agree. You know you are an IDS student.
But I by the way.
Yeah, tell us.
IDS student. It's more performative than impactful. I can say in our, when you are used to development aid, when you are used to being helped without being told, without being given a step to move or even to help others or to help yourself, you'll just be used to, you want help, and also those people helping you, there's a way they benefit to some point. That's why USAID was scraped off, and now it's coming back in another way, but they felt like someone else has to perform or take good, really nice pictures for them to say, like, we need these. Yeah, these people are suffering, we need high salaries. We need them to donate for, there are so many poor people in Africa. Now Africans, we have that. Not all Africans, but some people just want to perform that so that they can get more and more aid. And others are just used to being helped, such that when aid is removed, so we don't even see an impact. We don't see resilience. We don't see sustainability. That's why we have started seeing projects that need you to explain, like, how sustainable. When we cut funding, how will you continue in the next, sustainability. But for now, I can say most of the people who are even looking for aid, at first aid was okay, as much as it was, it used to help other people, because in terms of humanitarian, you just need to come in almost every time. But there are other people who just want to get aid, so they pretend, they perform some really, you see. So it doesn't even bring impact to the community. It's for self-benefit. So
for you, it's more performative than impactful?
To some extent.
To some extent.
Yes.
Because in as much as it's impactful, it's not sustainable.
Yes. Yeah. If you give me fish today, teach me how to fish tomorrow. Yes. So that's creating impact. But you see, that is. So the second hot take, we talk about empowerment, but are we ignoring economic realities for women? Yes, just like I talked about fishing and women in the beaches and lakesides. We empower them. We give them knowledge. We give them ABCD. Not even in beaches. So many women are empowered, but verbally. But in terms of giving them capital to start. Yeah, but then I also saw these in the lakeside. Apart from teenage mothers being taught how to fish, they also being taught how to, because they were born in a fishing zone. So they know that as an economic activity. So they're also being taught how to save and to grow as those small chamas. Yeah, and that was quite a nice thing. But then we need to continue empowering women in, not give them by word of mouth, but by just giving them a step. Capital. Something tangible. Yes, yes. Very so, and important. Our last hot take. Are we romanticizing resilience instead of fixing systems? I was telling you earlier how I was hearing, I don't know who it was, akisema how we are used to suffering nile ita change koja tu atitulia hata mimi nita make it. like unaipackage unasema acha niumie tu sahi unajua nita make it but then do you have plan on how you are going to make it or unasema tu siku moja God unajua God pia huwa anasaidia watu wanajisaidia so as much as unatuambia uta make it have a plan don't
really do
and a good plan si ati unaiweka in a very sexy way ati now this is resilience mambo no
na sasa it's a system failure literally we can see this is a
system failure.
But we want to hold on to it yani Kenyans or rather Africans we are so used to hardships it's part and parcel even hata kitu mzuri kikuja we are like where is the suffering in this
ati zinaitwa ati what like now when you are making it now issues of floods and how you'll make it like people resilient to floods people resilient to problems yani you are used to that problem that it's just part of you ati nimezoea like umezoea hiyo shida
nimezoea tumezoea
mpaka you are making it a norm uko like no this is not okay you are okay with being in that problem you are used to it hadi imekuwa resilient kwako but it's actually a problem that you need to deal with
that needs to be dealt with
and we actually as Kenyans and everyone we need to remove that word from our mouth don't enjoy suffering don't get used to suffering that it's a norm yes it's a problem see it as a problem and try to see how you will solve that problem
some interventions. Okay, give us some opportunities. I know as we currently speak, before you find it, there's a Youth SDG week that will be happening at Kenya School of Government. As we speak, it's ongoing. Maybe you can check it if you happen to listen up until this part of the podcast.
Yes, and also there is a Kofi Annan Next Gen Democracy Prize. I know we normally talk most of our viewers, our listeners.
Yes.
I almost forgot we don't have a video, but at least we are working on that soon. Most of our listeners are people who practice democracy, governance. There's a Kofi Annan Next Gen Democracy Prize 2026 for young leaders committed to advancement of democracy. The application date is 17th May 2026. That's an opportunity that you can grab. And as we conclude, this week has reminded us of something simple, but it's very heavy. Some of us thinking about self-growth and others are just thinking about survival each and every day. Yes. Oh, and maybe the real question is, how do we build a Kenya where those two things can exist together? Yes. So we look at appreciating life each and every day. We look at just when you wake up telling God, thank you. Just having gratitude over you just have, and continuous awareness. Yes, on these issues. Otherwise, it's been a great experience.
I don't know what to say for my end. I don't know if it's great or bad, but
too much to digest.
It's too much. We still reflect on that. It has been an amazing episode. Catch you next Monday. Same time, same place. Bye-bye.
Bye.
Toodles.